Good morning and welcome to County Executive Pittman's virtual press conference. Today, the County Executive will provide legislative and health initiative updates. We will take questions after the updates as usual. During the question portion, please put your name and media affiliation in the chat and we will call on folks in that order. Please keep your microphone off and your camera unless you're called on for questions. And with that, I'll turn it over to the County Executive.
Thank you, Renisha. I want to start out with the County Council meeting last night. 4 good bills got passed, 7-0. It always feels good when we can bring the whole council together and agree with initiatives. All 4 of these were bills that we brought to the council. And the first is one that has been debated for many weeks, the Green Infrastructure Master Plan approval. And one last amendment was proposed last night. We called it the Don't Say Green amendment that would prohibit agencies of county government from referencing the plan when reviewing development applications. Pleased to see that amendment went down. The Green Infrastructure Plan should be referenced when reviewing development applications, even though it's not a regulatory document. So the bill it did pass 7-0, and so we can get to work preserving 30% of the land mass of Arundel County and protecting it from development and keeping it green. So thank you for that, County Council members. Bill 2722 passed last night also, and this was a bill to give the same pension benefits to same-sex spouses of public safety officers as other spouses. Same-sex spouses who were married before 2013 when same-sex marriage was legalized in the state of Maryland. So that will be a relief to many and an issue of fairness that we were pleased to finally get across the finish line last night. Bill 2822 reclassifies positions among our first responders, our 911 operators, and it recognizes the training and the skills that these 911 operators have and reclassifies positions so that they can get paid more for the work that they do for the residents of our county. That was also 7-0. And then finally, Bill 2922 was to release funds from our tax increment finance district in Odenton to begin the construction of the Odenton parking garage at the MARC station. So this is a real economic driver that we've all been waiting for the Odenton master plan to be fully implemented, to do transit-oriented development in Odenton, that along with the park that we're building next to the library, and some streets and sidewalks and other investments that the county is making. We expect to turn Odenton into the community that was originally envisioned, and thank all the council members for voting unanimously for that. So good night last night. The only other thing that I want to raise tonight before we have questions is that this week is National Public Health Week. And we do have Dr. Kalyana Raman here to talk about some of the things that are going on at our Department of Health. But I just want to say that I have always said, and I think many of us believe, that local government really should be judged based on the health and wellness of the residents that it serves. And you will see in my budget that we will be presenting at the end of this month that it truly is a health budget. And when I say health, I mean all of the social determinants of health, as well as the things that we traditionally think of in a Department of Health. So you will see it in the Crownsville Hospital Memorial Park funding. You will see it in all of our parks budget, allowing people to get out and be healthy in our natural environment. You will see it in our housing budget for affordable housing and our housing trust fund. You'll see it in our budget for transit to get cars off the road and get people around our county more easily. But you will also see it in our Department of Health, support for our health equity and racial justice team, our gun violence intervention team, our opioid intervention team, our Bureau of Mental Health and crisis response teams. You'll see it in our support for our school nurses. And then the ones that I think we have to thank and recognize during this week are particularly the folks who did so much good work in our communities and in our Department of Health, getting us vaccinated and saving lives. And Anne Arundel County, as we know, over 1,000 of our neighbors lost, actually 1,045 as of current count. But we had the third lowest death rate in the state of Maryland. And we know that had our Department of Health and our communities not stepped up and done what they had done, our death rate could have been at least double that, as it was in other counties in Maryland that did less. So third lowest death rate, third highest vaccination rate. We're now at 77% vaccinated and 59% boosted. And our case rate down to 5.5 and only 5 in our hospitals with COVID right now. So thank you to everybody at our Department of Health. And I want to turn it over to Dr. Kalyana Raman to talk about some more specifics during National Public Health Week.
Thank you, County Executive, and thank you for your support, not just of what we do, but of health as a really as something that we have to do as a community, and that it is the goal that we all want to live healthier lives. Every year during the first full week of April, communities across the United States observe National Public Health Week, and this year the theme is Public Health is Where You Are. It's the places where we are physically, mentally, societally. They affect our health and our lives. And so today's a good time to talk about where we are in the county. With COVID, we've been through a lot over the past 2 years. There's the physical toll from COVID, people who've died, over 1,000 people, as the county executive noted, and many thousands more who have long COVID with longer lasting consequences. So while we're in a new phase, we have vaccines, at-home tests, masks, and medications for treatment. We know that having the tools are important, but we have to keep using them. So let's keep using them. There's also the mental health toll of the pandemic, and it's touched all of us, some more so than others. If you're struggling or know someone who is, help is nearby. Please call the county's mental health warm line for support. And while we focused on COVID a lot, there was also a lot of other work taking place, and I just want to highlight a couple of those. We know that we need to do more improving the health of all people. We just talked about public health is where you are. And so we know we need to do more to make sure that services are accessible to people. So last month, we began offering a range of services in the Lula Scott Community Center in Shadyside in South County. Those include WIC, which provides nutrition supports to women and infants, MCHIP to enroll low-income children into Medicaid who don't have health insurance, Wellmobile so that we can do same-day initiation of medication for opioid use disorder and harm reduction services, HIV and hepatitis C testing, routine childhood vaccinations, and of course, continuing our COVID vaccination and testing. About making those services easier to get to, more people are going to be able to use them. Another effort is our gun violence as a public health issue. Whether violence injures or kills a child or an adult, we know the mental and physical consequences for those who are injured, the families, the community, they last a lifetime. And our goal is really to focus on the root causes of what leads to violence, and then how do we address them through community-based solutions so that we can break that spread. So one part of that is education. I want to highlight one thing that we've put out is our Youth Gun Safety Toolkit. It provides information on how to safely store guns and prevent injuries and death in children. It's an educational campaign by our gun violence intervention team, and it takes a harm reduction approach through education for parents and teens, and it provides concrete actions that gun owners can take. These are just a couple of things that we've been advancing in partnership with the community. And that's really what it is. Public health is a commitment to ensuring that everyone can live their healthiest life. So while local health departments certainly play a role in this, it's really up to all of us to ensure that we're building healthy communities for ourselves and our children's future. And I want to thank the county executive for really bringing that vision to life.
All right, back to you, Anisha.
All right, thank you, Mr. County Executive. First up, just as a reminder, put your name and media affiliation in the chat and we'll call on you in that order. First up, John Ferney from Ion Annapolis.
Hi, this is for Dr. K. Just a real quick question. I know the state has now stopped reporting COVID metrics over the weekends. Does that have any impact on the work that you're doing?
No, that does not. We're still looking at the data every day during the week. The idea behind that is that the changes aren't happening fast enough that we need weekend reporting. If we reach that point again, the state can certainly report them on the weekends as needed. So right now we're fine with that.
Okay, great. Thank you.
Rob Lang, WBAL.
Hi, good morning. Mr. County Executive, any reaction to the new Congressional District Map that is now in place? What does it mean for Anne Arundel County?
Well, I think they're good maps. I think they're they're more compact. We have good people representing us in the county. We have a little bit more of Steny Hoyer, a little bit more of John Sarbanes. We love them. I think they're good maps, and it's good to have it finally resolved.
Okay, thank you very much.
Thanks, Rob. Last call for questions. All right, seeing none, that's a wrap. Thank you all.
Thanks.